I'm John Strum, and this is Real Talk MS. It's February 8th, and we have a lot to talk about. It would seem that living with MS is enough for anyone to have to deal with. But research shows that about 50% of the people living with MS will also deal with another chronic health condition in their lifetime. Those other unrelated health conditions are called comorbidities. And whether it's high blood pressure, diabetes, or something else, living with comorbid conditions adds extra challenges to living with MS. Joining me today to discuss how comorbidities affect people living with MS and some things you can do to avoid developing some comorbidities is one of the leading experts on the subject, Dr. Ruth Ann Marrie. Dr. Marrie is a professor of medicine and community health sciences at the University of Manitoba in Canada and the director of the Multiple Sclerosis Clinic at Health Sciences Center, Winnipeg. But before we get to my conversation with Dr. Ruth Ann Marrie, there are a few other things that you should know about. Swiss biotech company Genuro announced the completion of the Phase 2 clinical trial of Tumelimab, a potential disease-modifying therapy for relapsing remitting MS, and we can expect data from this clinical trial to be available next month. So, since we don't yet have the results from this clinical trial, why are we talking about it now? Well, there are a couple of reasons that I think this is worth talking about. First, Tumelimab represents a different category of disease-modifying therapy. It's a monoclonal antibody that's designed to work by blocking the mechanism suspected of causing the neuroinflammation that's associated with MS. By neutralizing a specific protein, Tumelimab is supposed to prevent the inflammatory response that damages myelin. And I think this novel approach to preventing neuroinflammation is worth pointing out. The other reason that Tumelimab is worth discussing is because it has an interesting history, an interesting story that I think illustrates a commitment to solving MS that I see throughout the scientific community. Tumelimab has already undergone a previous Phase 2 clinical trial and an open-label extension study. The results of those studies were reported this past summer, and in those studies, 2 years of treatment with Tumelimab was shown to slow disability worsening, reduce the loss of brain volume, and preserve myelin. But the trial fell short of meeting its primary goal of lessening neuroinflammation. Now, the 3 different doses of Tumelimab that were used in these studies were considered conservative by researchers. So rather than give up and move on, this latest Phase 2 clinical trial was launched to evaluate the safety and tolerability of Tumelimab at a higher dose. This trial evaluated 3 higher doses of Tumelimab, and as I mentioned a moment ago, the top-line results should be available in late March. Genuro has already announced that if the data from this trial supports further development of Tumelimab, they're ready to launch a Phase 3 clinical trial. So stay tuned for further developments. While we're talking about clinical trials, but not about clinical trial results, there's some other news that I think is worth sharing. You might remember that last month I told you that Dr. Victoria Levitt, the co-founder of eSupport Health, was recruiting people for the CONNECT study, a study funded by the National MS Society that's focused on using virtual support groups as a way to manage depression and anxiety among people living with MS. While any adult living with MS was invited to qualify to participate in this study, Dr. Levitt was particularly interested in recruiting members of the Latinx and African American communities because these groups have often been overlooked when it came to enrolling participants in research studies. So Dr. Levitt got in touch with me last week to share some good news. First, she wanted to let me know that recruitment for the study had closed, and while their goal was to enroll 80 study participants, They ended up with 230 participants, 95% of whom were African American or Latinx. This is a great example of what happens when underserved communities aren't underserved. Then we can see members of these communities respond and get involved in clinical research. Dr. Levitt pointed out that one of the study participants was hospitalized due to COVID-19, and this participant still found a way to participate in the virtual study from their hospital bed. Well, to me, this is all a very positive indicator that the research community is ultimately going to find success when they focus their efforts to make clinical trials more diverse. And that means those trials are going to produce more meaningful outcomes. And that's always good news for everyone. I know most of you don't need to hear this from me, and I also know that some of you still do. So for those who still need to be reminded, please get your COVID-19 vaccination and booster. A recent study from the UK paints a very clear picture of why that vaccination and that booster should be urgent priorities for anyone living with MS. The UK MS Register COVID-19 study has followed 8,000 people living with MS in the United Kingdom since March 17, 2020. That's the very beginning of the pandemic. It's tracked COVID-19 frequency and its outcomes for the MS population. And this latest analysis, which is part of the larger study, points out that nearly 1/3 of the people with MS who experienced COVID-19 symptoms but didn't require hospitalization had those symptoms for 1 month. That's about 30% of the people with MS who experienced month-long symptoms, compared to just 14% of the people who didn't have MS. Now, we know that vaccination won't prevent you from contracting COVID-19. It's not designed to do that. But it has been proven to limit the seriousness of those symptoms. I've talked with multiple emergency room doctors and nurses, and they all say the same thing. The people dying from COVID-19 are mostly those people who are unvaccinated or severely immunocompromised. So if you're still unvaccinated, please review the evidence contained in the study from the UK MS Register and take the steps that can quite possibly limit your symptoms and even save your life. You'll find a link to that study in today's show notes. If you're a regular listener, you've heard me talk about First Descents before, because I am such a fan of the work they're doing. First Descents is a nonprofit organization that since 2001 has taken over 10,000 young adult oncology patients on more than 1,000 outdoor adventures that feature activities like rock climbing, kayaking, and surfing. In 2019, First Descents expanded their program to include outdoor adventures designed for young adults living with MS, and every one of these adventures is offered at no cost to the participants. First Descents has just opened registration for their 2022 programs, and the programs for young adults living with MS include kayaking on the Rogue River in Oregon, rock climbing in Estes Park, Colorado, and surfing in Santa Cruz, California. All of these programs are specifically designed for people with MS. They're adaptive, they're safe, and perhaps more than the activity itself, each of these outdoor adventure programs offers an experience that will stay with you for the rest of your life. To learn more about First Descents and the programs that it offers to young adults between the ages of 18 and 45 who have been diagnosed with MS, and to begin the registration process, you can visit their website at firstdescents.org, and you'll find that link in today's show notes. Speaking of registration, I want to make sure you know that registration is now open for the National MS Society's Public Policy Conference. The Public Policy Conference provides a platform and a framework for MS activists to speak with a single, clear voice, raising awareness about multiple sclerosis and educating our elected officials on the needs of people affected by MS. By sharing our stories and urging legislative action, MS activists have created real change. This year, the MS Society's Public Policy Conference is virtual, and that means you have an opportunity to attend and learn how you can advocate for change on important policy issues that impact the entire MS community. For the second year in a row, I have the honor of co-emceeing the Public Policy Conference with my friend Marcus Jones, and I hope you'll join us as an attendee. In just a couple of weeks, Barry Talenti, the National MS Society's Executive Vice President of Advocacy and Healthcare Access, is going to be joining me on the podcast to talk about the specific legislative issues that we'll be focusing our advocacy efforts on at this year's conference. But you can get a head start on participating in the Public Policy Conference by registering today. I can't ever talk about advocacy for very long without having to remind you that advocating on behalf of your own interests is one of the most empowering things that a person can do for themselves. So I hope you'll register for this year's Public Policy Conference and experience that amazing sense of empowerment for yourself. It's free, and you'll find a link to the registration page in today's show notes. If you're living with MS, it's likely that you'll also experience another chronic health condition in your lifetime. And that additional health condition can make managing MS, not to mention your overall health and well-being, a little more complicated. In a moment, Dr. Ruth Ann Marrie joins me to talk about how comorbid conditions affect people living with MS and how to avoid or at least better manage those comorbid conditions if and when you have to. Many people living with MS also live with other coexisting health conditions, referred to as comorbidities. And comorbidities not only have their own impact on your health, they can also negatively impact your MS. So treating these other health conditions becomes important not only to your overall health and well-being, but also as an important part of managing MS. Joining me to discuss comorbidities and MS is one of the leading experts on the subject, Dr. Ruth Ann Marrie, Professor of Medicine and Community Health Sciences at the University of Manitoba in Canada, and the Director of the Multiple Sclerosis Clinic at Health Sciences Center, Winnipeg. Welcome to the podcast, Dr. Marrie.
Thanks so much for the invitation to join you.
Your research has shown that more than half of the people who are living with MS will experience another chronic health condition in their lifetime. What are some of the more common comorbidities that affect people with MS?
Well, the most common conditions that we see are depression and anxiety disorders, as well as conditions like high blood pressure, high cholesterol, and arthritis, which tend to be common in people without MS, particularly as we get older.
Does having MS make someone more susceptible to developing a comorbid condition?
Certainly, when we have looked at this question, we found that most of the conditions we've looked at occur more often in people with MS. So, high blood pressure, depression, anxiety are clearly conditions that occur more often in people with MS. Immune-related conditions, so people often ask that question. So inflammatory bowel disease, for example, a certain skin condition called bullous pemphigoid, a condition that involves inflammation of the eye, uveitis are more common in people with MS. So there are many things that are different in people with MS than without MS.
Does having another health condition in addition to MS make the MS worse?
It does look like having another health condition affects MS in a few different ways. So we've seen that if you have more health conditions, you may be more likely to have a relapse. And in particular, having high cholesterol and anxiety appear to be associated with a higher relapse risk. And then sort of overall disease progression or worsening appears to be worse if you have multiple health conditions, and particularly conditions like high blood pressure, diabetes, as well as depression seem to influence that.
I'm wondering about age. Is that a factor in developing comorbidities?
Yeah, it's actually a really big factor for some conditions. So, unfortunately, all of us get older. And so whether we have MS or not, the risk of developing another health condition goes up. And so high blood pressure, for example, by the time you get to be 60, or beyond, about over half of people with MS can expect to face high blood pressure. High cholesterol gets to be more common. Diabetes is more common. Arthritis is more common as well. So lots of things to potentially deal with.
You know, when someone experiences a change in their health, I think it's easy for them to assume that it must be a new symptom related to their MS. And I think that's especially true if the symptom is one that's common among people with MS, like pain or weakness. Now, that new symptom may be related to MS, but it doesn't have to be. So what steps should someone take if they notice a change in their health?
Yeah, so that's actually a challenging problem for people with MS to deal with. So one of the things that I suggest is first that if you notice a new symptom, it's helpful to track it for a little bit, like when did it develop and how quickly, and what are the other associated symptoms? And are there other symptoms you recognize that you know are related to your MS clearly that are also changing, or something else? Do you know of any other changes in your health condition? And then I think, when you're talking to a provider about those symptoms, is actually asking the question like, yes, it sort of, I know I've had fatigue or pain or whatever with my MS, but pointing out to them whether it seems different to you or not. Like, I place a lot of weight on whether there's a possibility that is different, and even asking the question, I know this kind of symptom can occur in MS, but could it be anything else? What do we need to think about because of my age or my gender or other health conditions that I already have? And so I think just reminding people not to assume that every single thing that happens to you is your MS helps to open that box that sometimes gets closed in our heads so people can think through that process. And so, when people call our clinic, sometimes I'll say, well, yeah, it could be your MS, but there's something more important or maybe more worrisome that if we missed it would harm you. So we're actually going to ask you to follow up with your family doctor to check that it's not these three things. And if they say, no, it's actually not another health issue, then we can take up the MS management part. But let's not make sure we don't miss something that it might not go well for you if we miss that other thing.
You've been involved in research studies that found that depression and anxiety are prevalent disorders that occur alongside MS. Do we know why depression and anxiety are more common in people with MS?
Well, we're working hard to try and figure that out. So, when we first start to try and answer the question of whether, why two conditions are occurring together more often than we expect, we can sort of walk through a list of possible explanations. And so, one of them could be that there's a risk factor in common. So we know genes are important in MS. So you might say, okay, well, is there a gene or set of genes that are in common between MS and depression, for example? Or is there an exposure that we've had in life, like childhood trauma or smoking, for example, that explain those things? And then we could move down the line and say, okay, well, is it possible that having depression causes MS or the other way around? And then we could go down to the next tier to say, okay, well, maybe it's just random chance. But you have to kind of map those things out. And then we're starting to try and work through and chip those explanations off. So one of my colleagues, so Dr. Karina Kowalik and Dr. Adil Harood, sort of worked together to look at genes that we know are associated with the risk of MS and genes we know are associated with the risk of depression, to see if the depression genes were associated with an increased risk of MS and whether the MS genes were associated with an increased risk of depression. They were not. So that particular theory of ours was wrong. But we did find that genes that are associated with obesity or body mass index are associated with an increased risk of MS and depression, suggesting that there is at least some genetic background there. We've also recently looked at childhood trauma. So we know that people who experience abuse or neglect in childhood, whether it's physical or emotional, are at increased risk of conditions like depression in adulthood. And so we looked at that in a small group of patients in Manitoba and found that if you'd experienced that kind of childhood trauma or maltreatment, that you were more likely to have MS and depression than somebody who was healthy. So that suggests there are a few factors potentially in common. But to make life a little more complicated, if I haven't already made it complicated enough, is there are some researchers who've looked at where the damage due to MS occurs in the brain. And there's some parts of the brain where if you cause damage, it increases your risk of developing depression or, say, anxiety disorders. So I think that probably plays a role for some individuals. So I think the challenge we face in terms of sorting out why some of these conditions are more common in MS is that there probably isn't one explanation for every single case of depression in every person. And so we just need to keep sort of working through this systematically. Much like we keep trying to work through systematically what causes MS, is that we have some parts of the puzzle, but it's probably not an identical set of parts for every person.
While there may not be a cure for MS, depression and anxiety are conditions that can be effectively treated. What are some common pharmacologic or non-pharmacologic treatments for depression and anxiety?
So as it turns out, most of the strategies that we use when we're using medication for managing people with MS are to use the same kinds of antidepressants or anti-anxiety medications that we use in people without MS. That's where we draw most of our information. There have been some clinical trials of antidepressants in people with MS that have shown they work, although those studies have tended to be a bit older. So they've tended to use some of the medications that aren't as modern, that we don't tend to use so much now. We have more information about therapies that don't involve medication. So sort of counseling types of approaches, strategies like cognitive behavioral therapy, which is a strategy that helps us think about how to reframe our thoughts in a different way, recognize negative thoughts, and to work on sort of changing our behaviors as well. And those are really valuable tools to use because they don't have any possibility of interacting with other medications that you might be taking and don't have the side effects of medication. And in the course of the pandemic in the last couple of years, people have worked harder at making some of those types of therapies available to people through online systems. It makes them more accessible because it can be hard for people to get to mental health providers to get to the optimal treatment that they want.
You were a member of a research team that completed a 10-year study that looked at the association between depression, vascular disease, and mortality. Can you tell us what you learned?
Sure. So we were, interested in trying to understand. What I like to say is we're trying to understand if having MS plus depression, when we looked at the outcome of mortality, is it MS is worth 1 and depression is worth 1, so 1 and 1 equal 2? Or if you have MS and depression, do you get 1 and 1 equals 3? In other words, do you get a bigger effect because you have two different things at play? So we found that MS was associated with shorter life expectancy, which is known. And so in North America, life expectancy is about 5 to 10 years shorter because you have MS. And depression is also associated with shorter life expectancy, which we've also known. But what we found is when you put the two together, you do get an extra impact on mortality of about 13%. So there is a bigger effect of having both conditions than either one alone. So from my perspective, that's a really good reason to make sure if you're having trouble with your mood that you get it addressed.
If someone who's living with MS is diagnosed with a comorbidity that demands urgent attention, like cancer, for instance, it can feel overwhelming. What's the best way for someone to manage both their MS and a more urgent diagnosis?
So that can definitely be a challenging situation. Just urgent conditions like cancer, there's a lot of things that need to be figured out and plans of care that need to be done in a very big hurry. It doesn't give us a whole lot of time to process and think about things and maybe ask as many questions as we want. So I do think it's important when you have a life-threatening condition that condition is going to get priority, right? So that you can make the decisions that you need to make. So the important piece at that point is that your other provider knows about your MS and what you're taking. And what you hopefully have is that your MS provider and your, say, cancer provider get together to have a conversation, or at least communicate in whatever electronic fashion they communicate, to sort of say, well, what do we need to consider? Are there different cancer treatments that I would want to consider so as not to harm this person's MS, to try and treat their cancer effectively, but not to make MS worse, because you've already got enough things going on with the cancer? And are there things that the MS provider can do to maybe try and reduce or change some of your MS medications to make it easier for that cancer to be treated? So maybe there isn't a mixture of side effects or effects on blood cell counts, other things that might make it hard for your cancer physician to figure out whether it's safe to continue treatment and so on. So it's about trying to focus things down a little bit and make things simpler.
What about the impact of lifestyle choices on comorbidities? For instance, does being overweight have an impact on MS or on coexisting health conditions?
Yeah, so I think that's an important question. So being overweight or obese increases the risk of several health conditions. So increases the risk of developing high blood pressure and high cholesterol and diabetes, all of which have impacts of MS on their own. And being overweight and obese in particular, we think is associated with faster loss of brain tissue. So something we all face once we get out of childhood and into adulthood, but seems to make it faster. So that, sort of puts a premium on what can we do, for prevention. So, achieving a healthy weight and eating a healthy diet and being physically active fortunately can help with the prevention of coexisting conditions, may help with treating them, but also are good for your MS. So I regard those as things that work for everything. And so it's really nice when you can find one thing that works for multiple conditions. It kind of simplifies that plan of care that you have to deal with.
And I think it's even nicer when the thing that you find is not necessarily another pill or another injection or another infusion, but choices that people can make every day to help themselves, right?
Yeah, no, so it is, because those things are under your control and they can make you feel good about yourself. And they're things that you can engage the whole family in, right? So that's one of the nice things is, if you make healthier choices about the diet, then your whole family gets to benefit from that. And so you can do that. You can do that together. Being out and going for a walk, so you get more exercise, is a great time to take your kids outside and spend time with them. So it can actually really do a lot of positive things that fit into your life in a nice way. Nobody wants to sit and watch you take your needle and look uncomfortable as you do so.
Well, Dr. Ruth Ann Marrie, thank you for all you do to improve the lives of people living with MS, and thanks for talking with me today.
Well, I'm really glad to have the opportunity to talk about this. I think it's important, and it's great that you get to share this information with so many people.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/232. You'll find that link in today's show notes so you can easily copy and paste it right into your email or text. If you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.